Hi, I'm Dr. Park, and today I want to talk about the back pain that I've been suffering and how I overcame it. As a plastic surgeon, I spent most of my 15 years of career either sitting on a chair in the office or sitting on a surgeon's stool in the operation room. Now, through those years, I developed a bad case of neck pain and back pain. And today I want to talk about how I overcame the back pain and what exercise that I did and what not to do and what to do. First, I want to let you know, even though I am a licensed medical doctor, my specialty is not in back pain treatment. But I just want to share what really worked for me. Now, as most of you know that spinal column has certain curvatures, especially your cervical, which is your neck, and your lumbar, which is your back. Now, if we don't keep that healthy curvature, it could cause herniation, and then it could cause a lot of pain. And at the end, if it gets bad enough, you might need an operation. But we could do certain things to prevent this. One of the reasons why we have a weak spinal column and cause it to have a bad curvature is having a weak spinal rectus muscle on our spinal column, where you might be more familiar with backstrap. But we have to strengthen the muscle so that you will be strong enough and keep that curvature on a nice, healthy curvature. Because if that weakens, it's going to either push forward or push backward, and that could cause a pain. Exercise that really gave me a freedom from the pain is this. It's very simple. Lay on your back, have your knees bent, and put your hand on the side and lift upward like this. And you want to lift it up and push it up as far as you can, and then cut it up to 100. And as you cut it, you want to keep squeezing it upward. And this really strengthens your backstrap muscle or spinal rectus muscle, and this really helps to keep your curvature in a healthy angle. And also, you want to do sit-ups to keep your tummy tight so that you won't be pushing out forward, causing that hyper curvature on your lumbar. So when I was younger, I used to do sit-ups like this, like most people do, but as I get older, that actually caused more problem on my back. So now what I do is I just bend it this way and do this. And by doing this, and I actually do it up to 100 counts, and this really helps to tighten my tummy, but not causing pain in my back. I do these two exercises every day, and it virtually frees me from a back pain. You always want to have a lumbar support. So everywhere I go, either I have a chair that has really nice lumbar support, or I put a cushion on a sofa, dining chairs, anywhere I sit for a certain period of time, I would have a lumbar support. If you're going to sit on a chair for a long time studying or working, I suggest you get a really nice chair like this one here with a good lumbar curvature. Now, I had this chair for probably over 10 years. I pay over $700 for it, but on this chair, I could sit on, work for hours, and have no back pain. When I'm just sitting and reading my newspaper, I still have the little cushion for my lumbar support. Even when I'm enjoying my meal, I have the lumbar support. Or just chilling and watching TV, I still have the lumbar support. Even when I'm driving for a long period of time, for me to have my foot on an acceleration pedal, that creates certain pain in my back. So I always use cruise control and have a lumbar support in my back. It's also good to wear a belt and just keep your tummy in, because you don't want to have your tummy pushing outward, causing your lumbar to curvate forward. Now, I've seen a lot of people wearing their belt kind of low like this and have their tummy sticking out. Now, this is not really good for you because it's going to cause the curvature. Now, you want your tummy to be tightened up, so you want to have your belt to the point where it's not pushing out forward. Also, if you're not going to be standing for a long time, you want to find somewhere you can lean like this and take that pressure off of your lumbar. Now, most of you already know this. If you need to pick up something kind of heavy, you don't want to bend and try to put the weight on your back. You want to bend your knee, lift it up, and straighten your knee, and then carry. That way, you're not putting that extra pressure on your back. Also, if you're picking something light, even small things, it's best to have your one hand on your knee, go down, pick it up, and do this. This way, you're not putting any pressure on your back. Also, when you sleep on your back, that causes hypercurvature on your back. So you want to put a pillow underneath your knee, and that takes the pressure off. I could feel the pressure taken off already. And also, you do not want to sleep on your tummy. And the best way to sleep is sleep on your side, like so, but have a pillow between your knees like this. That takes the pressure off of your hip joint, so you don't want to have that hip joint pain either. I hope this was helpful so you can enjoy your life.